Good morning, everyone. I'm excited to moderate this panel. We've got some great topics to talk through about the human technology connection between humans doing a lot of the work and how technology is entering our workload. So, Denise, why don't we start with you? I'd love to just tee it up to both of you, just to tell us a bit about your role. You are the Vice President of Marketing at Bristol Squibb. Tell us a bit of what that entails.
So at Bristol Squibb, we're in the pharmaceutical industry, obviously, and part of my role is to better understand how we can get the right message to the right customer at the right time, considering what channels our customers like to go to. It's all about their journey, and if you think about patients and some of the diseases that they're living with to try to make their life better, they're all at different phases of that journey. So how do we make sure that we're getting them the information they need to really enhance their life, to be perfectly honest. And then we do the same thing with healthcare providers as well, as they think about how are they going to better understand the products we have to offer for their patients and which patients they're appropriate for. So it's really exciting, and I think I'm excited to talk about the human side of things as well.
Fantastic. And Melissa Gordon-Ring, you are the Global President of IPG Mediabrands Health. Can you give us a glimpse into your daily role and what you're responsible for?
Great question. And my daily role changes every single day. It is my pleasure to lead all the health business at IPG Mediabrands, and it's my role to help support not just the teams but my clients in terms of driving best practices, process, talent development, and more importantly, being able to partner with clients like Denise, doing great things together within the healthcare space, of which I've been working in for over 25 years and incredibly passionate about. So,
fantastic. Thank you both. You both work together daily. Your agency supports your brand, so you know each other, as we said in our prep call, far better than I know you. But I'm getting to know you both, and it's fantastic. I wanted to talk and dive first into this idea of the partnership among the humans at your organizations and how you two partner in this evolving world of technology. We know technology is coming into all aspects of our workflow, and it's helping us, and certainly AI is a big part of that technology. But let's start with the human element. Maybe, Denise, starting with you, tell me about the relationship with your agency, the relationship with other humans, and how you ensure that the human element of your work makes it to the final work product and isn't taken over by the machines.
Yeah, it's a great question, and I'm sure a lot of folks in the audience today and everywhere actually are just, you can't go anywhere without talking about AI and how is AI going to enhance our efficiency. And in talking with you, Mark, and Melissa, preparing for this, it's not just AI, but it is that human side of thing. You still need humans to make sure that what you're going to say and how you're going to work is relevant to them receiving that information. And partners like Melissa really understanding that side of things. If you think about our industry, in the pharmaceutical industry, I mean, someone actually has to ingest the product that we're putting out there to help them have a better life. So there's always that element of making sure they understand what we're talking about, understand why they should be taking this product. And I think keeping that patient front of mind is really important as we go into this technological sort of revolution of all these things that AI can do for us. I was telling you guys, I was at a conference a couple weeks ago, and something that really stuck with me was, technologically developed does not mean it's human relevant. And I think keeping that thought, at least, there's lots of ways that AI can help us be more efficient, but you still need to have that conversation with your partners, like we do with Melissa and her team at IPG, is really making sure that it's going to make sense to that end user when they receive that information that we're putting out there.
And Melissa, from your side, technology creeps into the agency every day, I'm sure, but how do you keep the human element with the relationship with Denise and your other clients?
To be honest, I think it's critical in terms of the way that we work, and it's almost cost of entry in everything that we do. We are doing what we can to really harness the power of AI with purpose, ensuring that it's helping to reduce the tasks that take a lot of time and don't drive significant value. But more importantly, I think in this time of crazy transformation and change and technology and uncertainty, right? There's just so many feelings. We need to be even closer with our clients and partners to ensure that we are in absolute lockstep with what their priorities are, because those will be changing as well. I think it's just really an incredible opportunity for us to find new ways to get closer. And it is that human, element and human within the loop as we think about AI as a technology and to power us all to help us move faster and make better decisions. And when we think about the healthcare world, how we can actually engage with patients to help them give a little bit more control to the things that are happening around them, and more importantly, allow them to connect to not just physicians, but to therapies that will help them and improve their quality of lives.
Yeah, very good. Melissa, staying with you, that sounds great. How do we ensure that our teams are doing that same thing, right? All the way down the organization, because there's humans that work for us, there's technology that works for us, in theory, right? But making sure that you're maybe up-leveling the team's knowledge and using technology in the appropriate ways that are trustworthy ways. Maybe tell us about the team development approach you take.
Sure. I think that it can be scary. I mean, on a personal level, it's absolutely scary. And I almost liken AI and using our different agents as when the pandemic happened and no one was really using Teams, and you're like, oh, I'll figure it out. And then suddenly you're like, oh my God, I have to do this. There's like no other way for me to work. And that to me is almost what this feels like, this moment in time. We ensure that our teams are aware of all of the resources that we have internally, as well as the training, but we also try to challenge them to make it interesting and fun. Across our health teams, we're even doing a competition about who can create the most interesting and most helpful agents, and making sure that we are not just sharing what we've created, but really trying to up-level it and almost make it more interesting and fun where you can. I mean, that's part of what we want to do in our industry. But more importantly, we have to listen and ensure that our teams have the psychological safety to raise their hands and say, I don't understand this, or what can I learn? And not be afraid to do that, because that's, we have to do that in service of one another. And the more that we do that, and the more that we listen and invest in that training, and ensure that they understand that this is not about replacements, this is about enhancements, then we'll bring everybody along the journey with us.
And Denise, how about you? I sense this, the T word, the trust factor.
Mm-hmm.
Maybe tell us about your teams and how they can have trust in the technology, but also the trust in their managers to raise their hand and say, I need help, I don't understand this. Maybe talk to us about that.
Yeah, so I think trust is such an important word these days in terms of, are you trusting what's actually being put in front of you? Can you trust your manager to have, as you said, that psychological safety of, I don't understand how this technology is actually going to help me, or I don't understand how this is going to improve my analytics or improve what I know I'm going to find out about our customers, et cetera. And I think knowing that about yourself and then showing that to your team is super important as well. I think there's a lot of, as I said, kind of talk around AI and how can AI help, but I don't really necessarily, certainly in my industry, we haven't quite figured that out. So it's not only looking at the tools that are available, taking input not only from our media partners like IPG, but some of our creative partners like Eversana and some of our agencies, that we want to make sure that everyone understands what we're trying to accomplish, and then how do you communicate that to the best of your ability, all while saying, I'm not sure this is actually going to work, or let's try this out, and it's okay to fail, and let's learn from what doesn't work, and maybe then we'll actually have a better product at the output. And I think it's a little bit different culture-wise to admit as a leader that you might not have all of the answers, and you might be unsure about how certain things are going to be working. And I think that's a little bit of a flip to maybe how we were 5 or 10 years ago. I've been in this industry for over 30 years, and your manager always had to have all the right answers. And I think it's okay right now for managers maybe not to have the right answer, or leaders to be questioning those same things, because that, I think, creates that culture of your team then saying, I don't understand this, or even your partners to say, well, how is this going to fit into our workflow, or how is this going to fit into what we're trying to accomplish strategically? And that, again, it's hard to do. Culture's like the hardest thing to change, but that's really important to start doing that from the top down.
Those are fantastic ways to approach what a revolution that we haven't really been through before. So let's shift the conversation a bit now to KPIs. And I want to talk about this idea, Denise, that you first said when we chatted previously, of getting the science out there. And I kind of view that as maybe it's a mantra, but it's really about the performance, like what you guys are looking to do around education, in the healthcare industry. So could you tell the crowd about what getting the science out there means?
So I think getting the science out there is really talking about the advancements that we have in our industry to really treat diseases, to extend human life, to make living with a condition a little bit more palatable for patients, and explaining that in a way that reaches a lot of different customers, which gets to some of our earlier discussions around AI, because you need a lot of different content to resonate with a lot of different people who are on this journey or who are just been diagnosed or who have been living with a disease for many, many years. And all of that is a little bit different. So the way that, to your question about KPIs, the way that we used to measure things were sort of eyes on screens or eyes on content or how many impressions did I get or how many clicks did I get. And we're really looking now more at the engagement of that content. How much time is someone spending with that content? What actions did they take after they viewed that particular content? And how can we ladder that up to actually having a business impact for us or to change their perception about something? And I think fundamentally as an industry, it's about really going back to our roots of what we do, and that's science. That's really creating products and understanding the human body and how all of the various elements of the human body work in order to provide a better solution. And I'm clearly not a scientist, or I would have said something other than all the various parts of the human body, but that's what we're trying to do with some very smart scientists and figure out what are those nuances and how can we get that information out faster so patients understand what their options are.
Super important, though, because you need that translation layer to humans to understand about the ailment and then about what the potential prescription could do for them to better their lives. So I thought that was one of the most interesting things that I learned in our conversation. So thank you for that. Melissa, in thinking about the media landscape and the patient journey, right? So Denise has talked a lot about the patient, but the omnichannel media landscape, you've got to have that same level of trust and understanding and then delivering the message that the Bristol Myers Squibb team and you come up with. Tell us a bit about delivering the message from an omnichannel media perspective.
Sure. I mean, I think the reality is we have so much technology at our fingertips and so much content is really trying to find the right spaces and places. But all that comes back to ensuring that you have the right, not just KPIs, but measurement plan in place and measurement partners. Right? So truly understanding what it is that you want to be able to measure. What does success actually look like? What does success look like across that journey? Once it's, in terms of diagnosis, in terms of looking for therapies, in terms of actual getting on therapy, and really being able to understand what those levers are that you can pull. What are those lagging indicators? What are those leading indicators? And ensuring everyone who's involved has a clear kind of North Star as to what it is that we want to be able to achieve. And sometimes that gets lost, not just internally, but within an organization, and making sure that everyone from the top down to that, first level of team member who is touching a business to the CMO of an organization or the CEO to understand what success actually looks like. But more importantly, also staying up to date on all of the different tactics, channels, levels of connectivity, and ways that we can push ourselves, our clients, and our partners even further so that we can move faster. And I love something that BMS says, and it's something that we learned even when we started our relationship a few years ago, is that patients are waiting. When you add that level of urgency to what it is that we do within this space, it actually adds some additional purpose, which is once again something that makes working within this vertical so special.
I'm just going to add one thing to that. I think as the world has become more complex of all the different places that someone can interact with content, whether it's in our industry or elsewhere, I think being really precise, and you hit on it, Melissa, about what you're trying to measure and how you're going to measure it against those segments. Because it used to just be undiagnosed or diagnosed patients. And now we're looking at them at various points along their journey because everyone's needs change as they progress through their disease or they progress through their treatment. And I think that's a little bit different of how we used to consider things. But it's really important as everything gets a little more complex. How do we still stay true to what we're trying to do? And as you said, patients are waiting, and our job in our industry is to enhance their life. And I think there's a variety of different ways that we can measure that now. Yeah.
Patients are waiting. There is no better call to action than that, to do a good job in our jobs of marketing to them and getting the science to them. as you both know, iSpot is a measurement company, so I love the idea of measurement, and we're touching on it a bit here, but I'd love to go maybe a couple clicks deeper about media measurement. What do we look for as success? I do want to talk about creative, but maybe from a media standpoint, Melissa, what do you guys look at from, is it a delivery of audience? Is it a certain media weight in the form of impressions? Or do you look for then connecting that to an actual business outcome?
It's all the things. It really depends on who our audience is, depending on whether it's a patient or even a physician. We can go down to actual script level, performance, and that really, for us, that's the gold star in terms of being able to say that our campaign actually worked. And tracking that across the board is one of those things that we within this industry can do, which makes it special and unique, especially when we look at the physicians that we've spoken to. More importantly, it's also understanding the data and how we use that data to feed into that measurement. What are those things when we think about that omnichannel experience or the next best action? How can we understand what one piece of creative or content does in terms of driving action and decision making and influence, so that we can then understand what's that next lever to pull. But it's a lot of data, all the data, and really finding the ways to distill it in a way that is meaningful, that helps us not just tell the right story, but pull insights out. And doing that in terms of a cadence that is actually meaningful. It's not always important. People are excited to have data on a daily basis or a weekly basis, but sometimes you need a little bit more time to be able to review and to understand and to give it time to breathe. And it's also ensuring that we educate our teams, our marketers, our partners on finding what that right cadence is to make some meaningful decisions.
I'm going to add to it as well. Sorry,
Yeah.
Mark. I think you hit on so many things, and I'll actually back it up a little bit into leveraging data to actually find new audiences for us or find certain patient groups, because organically people are going to be talking online or talking in forums or leveraging social media to talk about their disease, their condition, what they're trying to manage through. And sometimes we tend to use the same traditional channels because we're pharma and we're hard to change every once in a while. And it's working with our partners, with our media partners, to find where are those clusters of patients, and then collaborating together with some of our creative agencies as well about, okay, now that we found this cluster of patients, what do we want to say to them? Where are they along their journey? What is their current knowledge? What do we think they've been exposed to, so that we can add to that message journey to really help change their life? And that obviously involves quite a bit of data and quite a bit of analytics to figure out where the best place is to put those resources. But it all starts with trying to figure out where are people currently going, whether they're patients or healthcare providers. Where do they go now to get this information to either ask their doctor about a product, or if you're a healthcare provider, to actually figure out what patients a product is appropriate for?
No, so I love it. So maybe one follow-up question there is, within the industry, there's quite a bit of regulation, of course. How do you balance personalization and meeting the consumer where they are in that journey with some of the regulations that you're faced with?
We have so many regulations. We can't get anything out without it being reviewed about 3 times by a lawyer or by a compliance individual. So what we try to do is reuse a lot of the, again, getting back to analytics. So if we know what content is resonating with our customers, I can reuse that in a variety of different places, perhaps. Change the image a little bit so it's a little bit easier for our lawyers or our compliance folks to get their head around what we're trying to put out there. But we are extremely regulated. In the United States, everything that, and several other countries, everything that we put out there has to go to the government so they know what we're saying about our products. So it's a fine line that we walk down. And I think with some of this AI technology and some of the technology that is out there, it's bringing those individuals along with you. So bringing your lawyer along with you, help them understand what we're trying to do. And that, for me, has gone in my over 30 years in this industry and working on many, many, many brands, that's helped me quite a bit to help them understand how a certain channel works or how a certain piece of creative is meant to be out there in the universe, so that they can opine and think about what their concerns might be, and then we can partner together to make that actually work.
So I love that. And this is actually maybe back to the human element, but it's alignment within the teams. To either, whoever wants to pick this one up first, because I think it's a really important point. how do you achieve alignment? We talk about key performance indicators of a campaign, more importantly of a brand or of a business. How do you align your organization within the marketing teams? And I even like to extend this idea to the CFO and the CEO, right? Because the organization needs to be aligned behind what we're doing, especially in a highly regulated industry, but across any business for that matter, about what we're trying to achieve with a marketing campaign. So let's get into that alignment a little bit. How do you bring them in early on so that everyone is aligned to the KPIs of the campaign or of the brand? Either of you.
So I'll start with that, and then I'll let Melissa chime in. We have business planning cycles, obviously, and I think what traditionally we used to do is keep those very much within the brand team and the marketing team, some of our matrix partners, like a team that I've led in the past. And I think where we're at now is expanding that communication out to some of our other partners, so our legal team, certainly our finance team, so they know what we're trying to ask for from a budget perspective, and our compliance team. So getting back to kind of the origins of our chat here today, it's that human side of just explaining to people what you're trying to do, showing them, this is how we think we're going to get there, but we're going to learn along the way based on the analytics that we have or based on some of the KPIs that we've set up. And we might change that plan, but we're going to let you know when we do it so that everyone is really informed from the beginning thinking of what you're going to try to do and achieve with your brand for that year through until a campaign has been executed and we've had time to see how it delivered. And sometimes that's a little hard to build into your timeline, all of that human connection, but it pays in dividends if you do it.
I love that. I mean, we should absolutely build the human connection into our timelines. But I think we also have to address the fact in the world that we live in, this highly regulated space, those timelines can be 6 months to a year, right? So how do we also find ways to stop in, across that journey or that continuum to check in and have those moments of oversharing is what I will say. There's certain situations where oversharing is not appropriate, but when it comes to understanding content and creative and measurement and goals, oversharing is critical. Really understanding once again what those key, creative moments or those engagement moments that we can identify and build on is really important because that can change too across the journey. But really staying true once again to what we want to be able to achieve in reaching patients to give them those choices.
So we're here at Cannes. I know we spend a lot of our time in the media world and measurement and KPIs in media, but let's talk about creative, if we don't mind for a minute. And again, I know there are some regulations within creative, but there's also some, I almost feel like pharmaceutical advertising is kind of forced to be a bit more creative because you're bound by some of the things that maybe you can't do in your industry where you can in others. Denise, tell us a bit about the creative planning process and how the marketing organization at BMS approaches it and how you then we've talked about the media side, but really campaigns start with creative and the message you want to get across to consumers and providers.
So I think it all starts with your customer insights, whether it's for the healthcare provider or for the patient. It's really understanding what their needs are from a content perspective. So what information do we think they need to understand more or understand better when it comes to knowing our product, how to use our product, who is appropriate for our product, et cetera. And then from there, it's really that partnership of not only what information do we think they need to understand from the insights that we get, but also taking a look at how are we communicating that? What are those creative elements? What colors do we want to use? What actions do we want to have these patients be doing in our advertisement? And obviously we do a ton of market research. And I think that whole cycle is changing as well, because I don't have to do market research now sitting in a room with people looking at storyboards. I can actually put a little bit of creative out there, kind of straw man sort of creative, if you will, see how people react to it, get those insights, and then continue to evolve what it is we're going to get out there and say to our patients. So I think it all has to start with what do we have to offer based on our brand? What is that unique value proposition of the brand? And then how does that marry up to the insights that our customers have, again, whether they're healthcare providers or patients? And then how quickly can we learn how well that message is resonating? And are they moving along that message journey that we think that they should be moving along in order to better understand our product? And if not, how do we quickly pivot to do something else?
I was
It
going to
all
ask.
sounds so easy.
It does sound easy. I was going to ask you how quickly you can pivot in some of those areas.
It's steering the Titanic.
Yeah.
Well, I think, again, I don't want to make this sound too overly simplistic, but back in my early days as a brand marketer, I'd have one creative campaign and we would just go forward and get that approved through our regulatory process. And now I think it's understanding that if we've got a new piece of data that talks about our 5-year efficacy against melanoma with a certain oncology product, then I think we need to go into our review process with 3 or 4 different creative elements of what that is, or maybe 5 or 6 different claims that we want to make, so that we have the opportunity to cycle through them faster, not only based on the reaction in the marketplace, but also based on where that patient is along their journey. So it's taking the time in the upfront part, not the upfront media purchase part, but the upfront planning part, to really understand how many different iterations of this creative can I have, so I have the freedom to swap it out and get that back out there faster, versus what we used to do, which is, all right, that creative campaign's done, now let's start the next creative campaign and the next creative campaign.
And maybe some of the omni-channel executions that Melissa and team help you with, assist with that, because you can test in social or be in areas where you can be a little bit more dynamic, I suppose, right? Yeah. Melissa, do you want to comment on that?
So, I'm going to come back to something that you said just a few minutes ago in terms of, I've always say this in terms of working in the world of pharmaceuticals and healthcare, is that we have to be more innovative and more strategic than everybody else, because we have so many hurdles that we need to jump over to get things approved. It's almost how we entice people to work within this vertical who are like, I don't want to work in healthcare, but healthcare is actually such an incredible space and allows us to be more creative than you would have to if you're working on like a fast-moving consumer good or something that everybody wants or needs. And I think that the payoff is even bigger when we can tie that to that connectivity and the content that's the right content at the right time, and understanding as well that more content doesn't just mean that's better. It's not always good. It's the right content. And using the tools that we have, even just some of the new tools that we have over at Mediabrands in terms of AI, and actually it's new, but being able to utilize AI to help us test some of that creative and really understand if it's the right thing for your target, for your physicians, for whomever it is that you want to speak to, so that we ensure that that volume of creative is being utilized in the right way, and that we can keep our teams, our legal teams, everyone across the board focused on the stuff that actually really matters.
No, great response. Bringing back the human element, I'm just curious, how often do you guys like call each other and text each other and say, listen, is this idea crazy? Or I saw this one metric and...
Melissa might say too often.
Right. That's okay. But once again, it comes back to that human element and that trust and the relationship that I'm lucky enough to have built with Denise, and Denise with our team and our leaders who are here today. I think it really makes that difference. We've broken down so many walls about what formality is in this, in this age of technology. And once again, it comes back to those shared goals. And if you can communicate faster to get things done in a more informal way, we're going to do it because we all believe in the same stuff.
It's not always those fun, sexy conversations, because I've had many conversations with Melissa and her team, and I see some other folks in the audience, about some really exciting things like tagging. Right. Who doesn't want to talk about tagging your media all day long? And isn't that just sounds so exciting?
we live in that world too, yeah.
Well, but if you don't do it right, then you're never going to know how anything works in the world. So it's not always those fun, crazy, hey, this campaign, what do you think? It can often be, do you think we have the right campaign name to know how this is going to work against those targets? So it gets a little geeky at times too. Right?
Sometimes those tactical things, though, really make a big difference, and then they kind of make the campaign and the insights sing. All right, we're just about out of time. Final question to both of you. We're here on day one of Cannes. What do you want to learn from this week? Some insights you can bring out of the sessions you're attending and the meetings you're having this week that you can bring back to your role in the States and apply to your marketing campaigns?
I think it's just exciting to have all these support companies, analytics companies like yourself, all the media outlets here to see what's coming next, and then take the time to figure out how is that going to actually fit into what we're trying to achieve from a strategic perspective. So it's a lot, but it's exciting.
Thinking big is good. Melissa?
I'll say one word. I want to be inspired. That's it. There's so much great content. There's so many good conversations. I want to be inspired to figure out what's next, and figure out new ways to come up with solutions that really can make a difference in our healthcare world. So.
I love it. Great note to end on. Denise, Melissa, thank you very much for sharing your insights
Thanks
with
for
this
having
group.
us.
Enjoy
Yes,
the rest
thanks
of your can.
Thanks for
Thank you,
having
you
us.
too.
Thanks, everyone.